Menopause is having a moment, and you may have a lot of questions about your midlife transition. And it seems like in the past few years, there's been all of this emphasis on all the risks of hormones and all of the bad things that can happen in menopause, and not talk about some of the treatment options that may help you not only have a better quality of life day to day, but a longer term, healthier life. So let's talk a little bit about the first stage, which is perimenopause. Perimenopause is a hormonal roller coaster, and it's that time when periods are typically pretty irregular and where fertility is variable. So you may be able to get pregnant, you may not be. You may be in your late 30s or your 40s and having very irregular periods. You may also be having some hot flashes or night sweats. The thing is that things come and go. So you may have a few symptoms for 3 to 6 months and then feel like yourself again. It's super confusing. Plus, there's a whole lot of other symptoms that you may have that may be different than what you associate with menopause. You may be having irregular periods. You may have muscle or joint aches, maybe some brain fog. Maybe you have very high libido or breast tenderness. Maybe you have some new headaches. Maybe you're starting to have a little bit of leaking of urine and your sex drive is changing. Maybe orgasms aren't what they used to be and you're not producing a lot of lubrication. But then you might go back to the way you felt 3 or 6 months ago. Perimenopause, this transition, kind of like puberty in reverse, this can last for 3 to 7 or more years with a lot of unpredictable symptoms that come and go. In perimenopause, 50% of women will have irregular bleeding. When do you need to call your provider? Call if you're bleeding for more than 10 days or you're having more than 2 periods in a month. Call if you notice that you can't leave the bathroom because you're bleeding through all of your protection and that goes on for more than 2 hours. The typical reason for heavy bleeding is because there's not regular ovulation and hormones get out of balance. That means that there's typically a lot more estrogen, there's no ovulation, there's no progesterone to balance it, and so many women find their periods are irregular. Some women have heavy bleeding because of fibroids or polyps. Many women are afraid to talk to their healthcare provider about it because they figure, well, the only solution is going to be something invasive or painful or even surgery. But things have changed. So if you're having heavy and irregular bleeding and it's causing you to feel more tired or exhausted or have headaches or kind of feel like a rushing or roaring in your ears, you may be anemic from that heavy bleeding. Talk to your healthcare provider because there are lots of treatments. Some are just medications. Some are minimally invasive to treat that bleeding, but do get that evaluated. The other thing that happens in perimenopause is that some women get spikes of estrogen, so they may have a real high sex drive and lots of breast tenderness. They may feel like they constantly have PMS symptoms, like their periods are going to come any minute, and then it doesn't. They can also have a lot of mood swings, a lot of anxiety, and sometimes there's a lot of temperature changes. And you may feel like, well, I just wore too many clothes and so that's why I'm sweating, or I'm using too many blankets at night. But here's the thing, if you're having any sweats on the back of your neck or you feel clammy in your skin, that's probably some temperature changes that occur because the internal thermostat in our brain, that's changing during the perimenopause and menopause transition. It's all related to fluctuating estrogen levels. So if you're starting to feel those symptoms, you can talk to your healthcare provider about different options. Many women who don't smoke, who don't have migraines with aura, that is when they see flashing lights, many women who are in their late 40s can safely use a birth control pill to help take those hormonal roller coaster rides and kind of smooth them out during that perimenopause transition. Many women also find that by using a progesterone-containing IUD, that can help reduce some of that irregular bleeding and spotting that's so common during perimenopause. So what is menopause anyway? Menopause is just one day. It's just one day when there hasn't been a period for 12 months or more. And then the next day, a person is considered postmenopausal. Most of the symptoms of menopause happen in perimenopause with hot flashes and night sweats, exhaustion, anxiety can go up. Depression is also an issue. Muscle and joint aches. How are all of these things related? Well, it turns out that our hormone estrogen, which is a natural and normal hormone that's been in your body since you were 12 and going through puberty, that hormone influences just about every aspect of your life. Virtually every cell in your body has an estrogen receptor. And so as estrogen levels fluctuate or decline, you're going to notice symptoms. You might notice muscle and joint aches in your hips or your knees. Why? Because estrogen is a precursor hormone for collagen. That's the substance that is between your joints, right? That keeps your muscles and your joints healthy. Estrogen also is a precursor hormone for serotonin. That's the feel-good hormone or neurotransmitter in our brain that makes us feel good. So with less estrogen, we have less serotonin, which is why there may be more depression and anxiety. And we certainly see this all around the world with women who are at midlife and beyond. So virtually everything can be impacted, from having dry eyes, dry vaginas, loss of sex drive, changes in our sexuality. We can even start to have some leaking of urine as we get older because estrogen levels are dropping. So I want to address something. A lot of people say, well, you know what, menopause is just a natural condition. Actually, it's not. Because if you look back about 150 years, most women didn't live much past their 40s. So it wasn't natural to go through menopause because it wasn't natural to be alive after 45 or 50. So when people say it's natural and you should just put up with it, I call that gaslighting, because there's a lot of issues that happen in our bodies as we get older. So when we talk about natural processes, as people get older, it's also natural for them to lose their teeth. But we don't tell people to stop going to the dentist, right? So when we talk about hormones and menopause, it's really important that we listen to women, we listen to their symptoms, and then we either try to prevent the long-term issues or we try to address what they're dealing with in the here and now. So with menopause, as estrogen levels decline, many women will notice things like hot flashes and night sweats. Many women find that they can't sleep through the night. And when there's a lack of sleep, there's a lot of other issues that come long-term, from not being able to find a word on the tip of your tongue because you're so exhausted and tired, to being more depressed and anxious. So lack of sleep, we know, is related to the midlife transition. And there's lots of things that you can do to help that. Of course, there's sleep hygiene, right? You know all about that. Not having a pet in the room, not looking at your computer and television all night. But also, there are medications and hormone treatments that women can take that will help restore their estrogen levels, help restore sleep. Now, maybe you're not interested in using hormone treatment. There are new non-hormonal medications that work in the brain's temperature center to help reduce hot flashes and night sweats. And there's also medications in development that can help with sleep. So stay tuned for that. And of course, if you want more information, you can go to menopause.org. That's the Menopause Society, to learn more about different options to treat menopausal symptoms. The most important thing to do is to listen to yourself and don't allow anyone to minimize your symptoms or tell you it's just natural, just deal with it. Because a lot of the things that you're experiencing can have not only an impact on your day-to-day quality of life, but on your long-term quality of life. So if you're not sleeping well, if you're having a lot of temperature changes, if you're feeling more depressed and anxious, if you're having muscle and joint aches that really prevent you from doing the things you love, then do talk to your healthcare provider or find a certified menopause practitioner in your area. And I hope that helps. So leave me a comment below, click like and subscribe if you like this video, and tell me other things you'd like me to talk about.